So one of the things that disability assessments for peer reviews requires is to assist the individuals who are processing the benefits understand what's going on with the medical records. They typically are going to be individuals who are college educated, but they may not have a lot of medical training. And some do, but typically they may not. So what they're going to do is ask you to explain to them what's going on clinically. And the most important question is, what are the restrictions? Are they reasonably supported? If so, why? What is the rationale? What's the start date for those restrictions? And at which time should they be reassessed? So, for example, as I indicated, maybe a sprained ankle. If someone has a severe ankle sprain and they're restricted from activities such as standing and walking, climbing ladders, all those things that may be reasonable to restrict someone from. At what time would that restriction start? Usually it's going to be at a date of injury. And let's say that it would be reasonable that they have a reevaluation by the provider in 2 weeks, 10 days. That would be the time frame that the peer reviewer would indicate it'd be reasonable to have a reassessment, and so on. One of the pearls might be to indicate that and then to have a description of what may be considered if new records are obtained, at that time frames. To prevent the need, for example, for that claim manager to refer it back to you to just review records again. So for example, if physical exam at that time shows complete recovery, or something similar to that effect, then restrictions would no longer be supported. Or if at that time there's continued swelling, there's continued evidence of pain and limitation of range of motion of the joint, then an additional 2 weeks of those restrictions may be reasonably supported. So giving that individual an idea of the things to consider so they can then go ahead and make their benefit determinations.